Welcome to the BioBalance Healthcast, episode 676. How to prevent a stroke. Start early.
BioBalance Healthcast features conversations about anti-aging medicine. Your host is Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging. Dr. Maupin is the author of The Secret Female Hormone, the seminal work about testosterone replacement therapy for women, and Got Testosterone, the award-winning book for men that helps men choose the most effective and safe form of testosterone replacement. These books are available on Amazon or from Dr. Maupin's office at BioBalance Health in St. Louis and in Kansas City. Dr. Maupin's office is currently accepting new patients.
Welcome to the BioBalance Healthcast. Today we're going to talk about something very serious and something that is on the top of my list of things I never want to have, and I will do anything to prevent a stroke. That's what I don't want to have. I don't want to have a stroke in my lifetime because it just changes your life completely. For people who, God love them, have had a stroke, it's very hard to come back from a stroke. It's very hard to live your life, and I give them kudos for being able to live their life after this. But if you know how to prevent it, then you won't have to go through that trial during this lifetime. So I don't know if you play this game, but long ago when I started medical school, I started a list of all the diseases I didn't ever want to get. And I think most doctors do that. Maybe everybody does that when they see somebody who has a certain kind of condition. But my list on the very top is I don't want a stroke. Partially because it changes everything. It can change your personality. It can change your ability to walk or to talk or to think. Your brain is where strokes happen, from lack of oxygen to an area of your brain. And honestly, this is something I don't want. After that, there's amputations and paralysis, and I have a whole list of these things. I don't know if you've ever thought like that, but of course, I think it's kind of a doctor thing, and but that's how much I care and worry about patients who are changing their lifestyle into a healthy one to prevent themselves from having this terrible outcome. It is a disease usually of aging. It's usually a disease or a condition that happens after we're 55, 60. So it is something that is far off in the distance for some of you. And I totally understand that you don't want to have to think about this. But if you don't think about it when you're 50 or 45, then you're not going to be able to have the proper lifestyle to keep all of your arteries clean and to keep yourself from having atherosclerosis, which is plaque on the inside of your arteries, which is one of the reasons, not every reason, but one of the reasons people have a stroke. So just in case you haven't wrapped your mind around what a stroke really is, this is how it's described or defined. It's a medical emergency that occurs when blood flow to the brain is blocked or a blood vessel bursts and bleeds into the brain. This can cause damage or kill parts of the brain, which can lead to long-term disability, brain damage, or even death. That is what happens. It depends on where the stroke is, what you lose, whether it's in a part of your brain that manages your walking or your thinking or talking. Any of your senses can be involved. In my practice at BioBalance Health, we are a preventive practice. We are trying to prevent things like this. And we look at all of your medical problems, medical records, drugs, and that kind of thing to balance everything and help you with a new healthy lifestyle that will prevent some of these things from happening. Now, for those of you who have had a stroke and have led a perfectly pristine life, it can happen to anybody. If you have a weakness in a vessel that you were born with, that can cause a stroke. If it's weak and you're exercising, it can burst and it can cause a stroke. So it isn't always preventive measures that keep you from having one, but in general, it's when this happens at old age, we can prevent or delay a stroke. So what are the symptoms that we think about with a stroke? And let me just say that a stroke is, in general, lack of oxygen to the brain, but it is also permanent. It's not a TIA. A transient ischemic attack means you had something transient that happened in your brain. You lost blood flow to a certain area. It came back. It didn't leave damage. If there's no damage left, it was a transient ischemic attack, and that's not a stroke. But that's a warning. That's a warning that maybe something you were doing, were you climbing a mountain in low oxygen tension? Were you screaming at somebody and your blood pressure went up? Did you forget your blood pressure pills? Did you dehydrate? And dehydration can actually cause a stroke as well, or a TIA. You have to think about, why did I have this, and what can I do to never have the next step, which is damage to the brain. So here are the symptoms that are typical, and I'm not saying I'm 100% complete on every symptom that somebody having a stroke might have, but generally a stroke is weakness of one side of the body, like this side or this side, or sometimes weakness on this side of the face and this side of the body. Facial drooping on one side of the face, like one side can't smile, but one side can. Dizziness, numbness, loss of balance, sudden loss of vision, trouble making sense when you're speaking. You're not making any sense with the words that you think you're speaking aren't coming out. Trouble talking, reading, or understanding someone who's speaking to you. Sudden nausea and vomiting, and usually a brief loss of consciousness, such as fainting, seizures, confusion, or a coma. Those all are signs of somebody having a stroke. So before we go into prevention, let me just say that if you think somebody's having a stroke, then the first thing you do is call 911. And then it is an emergency. And even if they perk back up, they should go to the hospital and be evaluated. Start asking the person, the patient, who's probably slumping in a chair or on the floor, to open their eyes, see if they can smile, see if there's any drooping, see if they can raise both their arms, and see if one of them falls. So if they can do this and that one falls, then they have a weakness on that side. Ask them a question, see if they can speak. While this is happening, the 911 people are on their way. So you are doing something in between to kind of give them information that you've gotten from this patient. And you can tell them if they've changed from the time you first saw the incident to 5 minutes later when the EMTs show up. If it's transient, great. If it's not, they're going to have to go to the hospital with the EMTs. They're going to get a lot of testing, MRI, CT, dye tests. They're going to look at the carotids. They're going to look at everything, blood work, to see why that person had a stroke and if it is going to go away or not. So, last month, the American Heart and Stroke Prevention Committee released new guidelines on how to prevent a stroke. And it's the first time they've really included changes in lifestyle, which I find really interesting because lifestyle is everything. And what I mean by lifestyle is exercise, diet, supplements, extra nutrition if you don't eat certain foods, taking care of yourself, sleeping 8 hours, having fun and work, not just fun. A balance of everything is really required for you to stay healthy. So, the first thing they suggest is to see your doctor regularly. If you're over 50, you should see an internal medicine doctor or a family medicine doctor every year to have blood work, to be, to just be evaluated, get an EKG. And if you are in an area that has Lifeline show up and send you invitations to come and have a carotid study and some other blood tests, then do it. It's free. So you should be able to do that and see if you've got any plaque or any narrowing in your carotids. So if you have that opportunity, please grab it. Now, stop sedentary behavior. Don't just sit around. I mean, honestly, we've got machines to do everything. They can vacuum for us. They can clean our floors. Honestly, you should probably just vacuum and clean your floors yourself so that you get up and move around. But we've made everything so easy that we just sit and push a button. Walk, exercise, do yoga, get out of your chair for the majority of your day. You can take rests in between, but actual movement is very important to prevent strokes. If you are diabetic, they advocate, this is the first time they've ever advocated anything like this, going on Ozempic or Mounjaro, because that will help your diabetes and you will lose weight. The lower your weight, the lower your stroke risk. When you lose weight, your blood pressure goes down, your lipids go down. You actually can move. It's not so onerous for you to just try to get out of the chair and move. So it's easier for you to have an active lifestyle. But for diabetics, it's even more important. These two drugs are miraculous at weight loss. They're miraculous at keeping people from having many illnesses of aging. So I think that is something, if you're a diabetic, that you should consider, and you should talk to your doctor about it and say, it's because I want to follow the guidelines to prevent a stroke. And so that's a reason that they should approve it for you. If you're hypertensive, if you have high blood pressure, take your blood pressure medicine. Now, if you've lost weight, you may not need quite as high a dose, but you still have to take blood pressure medicine if you have high blood pressure. Follow these lifestyle changes. This is called This is what the powers that be, the people that are in the American Heart and Stroke Prevention Committee say, follow these 8 essential lifestyle changes. Clean up your lifestyle, drinking, smoking, achieve healthy weight, physical activity every day, healthy diet, low carb, Mediterranean diet, no junk food, no fast food. Make sure your sleep is restful and that you get enough sleep. 7 to 8 hours should be enough. Don't smoke. We all know that increases risk of everything, heart disease and stroke. And achieve healthy levels of blood sugar and blood pressure. All of these things are in your court. These things are not my job. They're your job. It's your job to make sure you don't end up having a stroke. It's your job to ask your doctor the right questions, because he may be thinking about, the bump on your hand that needs referral, but you're thinking about how to prevent a stroke. You need to ask the questions. And you're getting the information here. You can use that information to guide your own life. But you need to make a decision to do it and stop having bad behaviors and stop doing things that are going to make you sick. They don't have alcohol on here, but honestly, overconsumption of alcohol puts you at risk as well. I don't know why they don't put it on here, but they don't. I add these recommendations. And once again, I do this stuff. You should do this stuff. I can only take care of myself and my husband. Drink half your weight in ounces of water every day. So if you're 120, you have to have 60 ounces of water. If you're 300, you have to have 150 ounces of water. That's required to keep everything in your body working. Water is necessary. Our body's 90% water, so we have to replenish it with fresh water all the time. We're like a plant. Get a cardiac calcium scan. That's a 2-picture CT scan that looks at your heart when it's squeezing in systole and when it's dilating in diastole. And it looks at the vessels, and any vessel that is covered in calcium has plaque in it, and that's what we're looking for. So that is a risk factor if you have a lot of plaque in your vessels for having a stroke. That needs to be taken care of, and you need to see either a cardiologist. Usually the cardiologists are the ones that take care of that. But whatever's in your heart is probably in your carotids and the vessels in your head too. So cardiac calcium scan can do 2 things. If it's good, if it's 0, you don't have any plaque, you can say, whoo-hoo, whoopee, I don't have plaque and I'm not going to have a stroke from that. other reasons. There are other reasons to have a stroke. But if you have it, you can get help by getting the medication and the diet counseling that you need to either stay the same and not make the plaque worse because it's a progressive problem, or there are a few drugs that actually remodel and can take away some of that plaque. So that's something you should discuss with your doctor. If you have the cardiac calcium scan, he or she is going to have to order it. Another option for the cardiac calcium scan is a carotid sonogram. Your carotids are right here. They're the main arteries to your brain. So if you read murder mysteries, that's what they're impairing when they're choking somebody. So a carotid ultrasound that just looks at those vessels can tell you if you have any plaque there too, and that's what's done in those life screenings that set up kind of temporarily and have the community come in and get tested. So that's also a great idea. You can do one or the other or both. Make sure your homocysteine level is less than 8. Homocysteine is a risk for a whole different kind of stroke. It's called an embolic stroke. Homocysteine collects in your arteries in certain people who are genetically predisposed to this, and it makes a soft, gooey plaque. You can't see it on X-ray. You can't see it on a CT scan. It's just a soft, gooey plaque because homocysteine is the product of B vitamins that you don't have the enzymes to actually use. So it has to get rid of it somewhere, puts it in your arteries. The arteries then let off little pieces of emboli. It also collects in the veins as well. So you can have emboli that block a blood vessel. It may get through your bigger blood vessels, but it goes to the smaller blood vessels in your heart, or it can go into your brain. And that can cause a stroke by blocking a blood vessel to an area of the brain that you need. So homocysteine should be less than 8, and that all that requires is changing your vitamins to take methyl B12 and methylfolate. Never, if you have a high homocysteine, don't ever take a regular plain old B12 shot. You need a methyl or hydroxy B12 shot. And never take the regular kind, because if you take the regular kind, it'll make this worse. So you don't want to give your body something it can't use and has to discard into your vessels and can be dangerous later. Take vitamin D and K2 to lower your risk. Vitamin D touches every cell in your body. It is necessary. We don't get enough from the sun because we're in North America and we don't live around the equator. And so we have to take it orally. There's very few people that I have in my practice at the 38th, 40th parallel, the latitude, that actually has a normal vitamin D level except in the height of summer. And that's still not everybody because we work inside. We don't play outside all the time. So we need vitamin D to keep ourselves intact and not have a stroke, keep our vessels healthy. Take non-oral estrogen after menopause. You're at higher risk of a stroke if you're a female and you have an early menopause. Why is that? Because you aren't making your own estrogen anymore. Now, if you take oral estrogen, God forbid, that increases your clotting, and a clot can cause a stroke. So I don't advise you replacing your estrogen with an oral pill. I advise you replacing your estrogen with a patch, a cream, or a pellet. That's it. That's safe. It will decrease your risk of stroke, not increase it. Testosterone pellets are excellent to help people decrease their risk of stroke because it causes the blood vessels to be more elastic. When you have elastic blood vessels, that's what you had when you were young. They could dilate and they could contract when you needed them to. Contracting increases your blood pressure. Dilating basically gives you more oxygen in the area of the dilation, and you want to have more dilation in the areas of your brain because that brings more oxygen. So one of the things we do, besides testosterone to do that, is we add arteriosol or Neo40. Those are two supplements that have natural vascular dilators, and it increases blood flow and oxygen to all of our organs, but we're talking about our brain now, and so increasing nitric oxide in your brain is very healthy, and you'll be able to think better, it helps your blood vessels dilate, and it brings more oxygen to the area. The last thing I think you should do prevention-wise is when you're outside in the heat or you're working out or you're doing hot yoga, you're losing electrolytes. You need electrolytes to have your vessels be healthy, your blood pressure, and your whole body requires electrolytes to function. You're losing them through sweat. So if you are sweating, you should, every third bottle of water, a normal sized bottle of water, every third bottle should have electrolytes in it, because you're not just losing water, you're losing all of the potassium, sodium, you're losing chloride, and you're also losing magnesium and I said potassium, excuse me. So all of those are in NUN, NUUN, and some other individually wrapped electrolyte companies make them so you can carry them with you. So that is what I recommend, is every third bottle of water, every third 8 ounces of water. The 38 ounce has electrolytes in it if you're sweating profusely, because you have to replace those. I just had a patient come back from overseas, and she was in Italy. It was hot. She was sweating. They didn't carry a lot of water. They did their own trip, so nobody's handing them bottles of water like they would on a cruise or something. And she'd eaten, but she had not really had any water. So by noon, she had been sweating, and she was in the Coliseum, and she passed out and had many of the signs of a stroke, which was worrisome. In Italy, they told her they thought she had a heart attack. And so when she came back, she said that she's gone through a huge workup for her heart and she's fine. But it was almost like a TIA. She threw up, she lost consciousness, she felt weak. And because of the electrolytes not being replaced right away, that is a problem, because that made her really tired for 2 to 3 days later. She couldn't get up and do anything. And so that's an issue. I mean, she's on vacation. 3 or 4 days, she has to stay in bed. Replenishing your electrolytes when you lose them is really important, and it can prevent you from having a stroke. So that's another reason or another possible cause of a stroke, but it can either be loss of electrolytes. It can be an emboli from homocysteine-produced plaque, or an emboli from hard plaque. It can also be a constriction of the blood vessels that blocks the flow, or it can be a bleed. And some people with high blood pressure, that have really high blood pressure, and if they exert themselves, then one of the blood vessels in their head actually pops and bleeds. So all of those things can cause a stroke. None of the outcomes do we want. We want to be healthy the rest of our lives, not dependent on someone else. And let me add this. If you have a spouse who's not taking care of themselves, but you are, it behooves you to convince them to take care of themselves, because you're doing the work for you and you're doing the work for them. They won't have to take care of you, but you will probably have to take care of them if they have a stroke. So it is very important that both of you as a unit get healthy, so that one of you is not having to be the caretaker of the other. Thank you for listening to this. I hope this gives you some data that you can use in the future to talk to people or talk to your doctor, or to just change your lifestyle to prevent any terrible outcomes like having a stroke. Thank you for listening.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. You can find Dr. Maupin on Twitter at Dr. Kathy Maupin and on Facebook at facebook.com/biobalancehealth.